chapter, and I am a secretary and a PRO, and now is our chairperson is Mr. Raza Khan is our chairperson from the who is leading the Pakistan chapter. So today is presentation regarding the TORG Pakistan and its introduction for the patient safety and its scope in the operating room. So I would like to invite Ms. Shadi. Please do the short introduction for the TORG chapter in Pakistan. Please. Thank you so much.
Thank you, everyone. It's a privilege to be here. First of all, I really want to say thank you to the chapter leadership, even for organizing this insightful and educational session. It's very good when we come together as operating room professionals to share knowledge, to share experiences, to foster collaboration and even improve the practices in our various locations. So basically, the Operating Room Global was founded in 2015, just as a brief way of introducing the organization. It was founded in 2015. Then the background was that I wanted to go to another country to work outside my own country, which was Nigeria then. And then I went online. I couldn't find a single information, a single platform whereby you can actually collaborate with everyone, that you can reach out to people in other countries. Like you have the option, you want to go to Canada, you want to go to Australia, you want to go to New Zealand, you want to go to Ireland. And then you're looking for this platform that has everyone in the same place, whereby you can just throw your question and people get to answer and clarify your questions, and then you can decide, oh, this is where I want to go. So basically, that was what I was trying to find online then, and there was no platform like that. So then I discussed that with the co-founder, and then we had to come up with a plan. Why not just develop something, bring everyone together under a single roof? Like operating room is diversity. When we come together, then the unity, the stronger we become. So that was the background then. So the Operating Room Global, basically, it's a professional platform for operating theater staff of all disciplines. All disciplines, I mean, not just surgical technologists, nurses are involved, surgeons, physician assistants are involved, perfusionists, every single profession that exists in the operating room environment. So currently we have over 70 countries represented in TORG, and we have over 100,000 membership. It's basically non-profit, non-political as well. And one of the major objectives, education, collaboration, and research. So thank you so much, everyone. Thank you.
Thank you so much, Ms. Adi. So it's a big opportunity for our Pakistan to learn the most professional things, and every 2 weeks, most probably every week, we continue the educational program, inshallah. So I would like to invite directly Mr. Dr. Raza Khan for the presentation. Today's presentation topic is already I told you like this. Introduction of patient safety and its scope in the operating room. Please, Dr. Raza Khan, thank you.
We can't hear you here.
We can't hear you, please, Dr. Raza.
Okay, can you hear me?
Yes.
Assalamu alaikum, can you hear me?
Wa alaikum salam. Yes, perfect. Thank you.
Okay, thank you. Thank you everyone, Mr. Naveed, for inviting me, and Madam Eddie. So as introduced by Madam Eddie about the operating room global talk, that currently we have more than 17 chapters, and there are more than 100,000 operating room professionals who were currently with our network. And recently, TORG was also launched in Pakistan, and so that's why, as a team building activity to develop the operating room professional, we are here with you. Uh, this is our mission and vision of TORG Global, that we are dedicated to advancing surgical care and enhancing healthcare outcome worldwide. We focus and foster a global network of surgical professionals providing education, research opportunities. Uh, and our ultimate objective is to improve and the standard of care to save the lives. And our key objectives are knowledge sharing and collaboration, education and training, research and innovation, advocacy for patient safety, and global impact of OR network, OR professional, and our network throughout the world. Okay. So let's come to our topic and my introduction. Basically, I'm Raza Khan, and I'm a member of operating room environment. Uh, I joined the network of operating room, the operation theater profession in 2004. After that, I worked on various roles, and currently I'm General Manager Operating Room Services. So, coming to our topic, I would like to ask a short question from our participants, our panelists, that what is patient safety? What you think? What is the patient safety? What is the patient safety called, and what is the purpose of patient safety? Yes, anyone can suggest? Okay, so I think there is some people saying in the chat box their definition. So exactly, the patient safety is the absence of preventable harm. Okay, some as we know, we describe most of the things by their definition, but we describe few things with their opposites. So the same is the case of safety and patient safety. The absence of preventable harm is called patient safety. We can say patient safety is a component and a result of good quality healthcare services and quality of care. We can also define, describe and the patient safety, and can measure the patient safety through improved health outcome and through improved health status. As you know, every one of us know that the patient safety is a very critical issue uh, in healthcare environment. And within a war, it is also a big challenge for us. So, how we can measure the patient safety? How can we ensure the patient safety uh, in our OR environment? So, moving on, if we ask about, let's suppose, sorry, there are a few participants whose mic is unmute. I would like request them kindly mute your mic, as it can create distortion. Thank you. So, why the patient safety is important? Why the patient safety is a serious issue? Because if we see globally, there is only 1 in 1 million chances of Boeing 17 or aircraft crashes throughout annually. If we can measure that, there are 1 in 1 million chances that an aircraft can crash. It can harm its passenger, but if we measure the same the chances of death in within the hospital sector, healthcare sector, then there are one of every 300 patients can die, can harm due to negligence due to patient safety issue. So you can imagine that this is the serious issue. This is a very serious issue than the crashing of an aeroplane. It is a very serious issue. It is the I can say it is the serious issue than the terrorism. This is serious issue, the political issues, like the chances of patient harm, the chances of death is very high, and it is one of a common thing which can through which we can save the lives, through which we can save the humanity. Um, as I already mentioned that 1 in 10 patient is harmed in healthcare environment in hospital, and most of these incidents are commonly happening in theater and critical care areas. 14% patients affected through healthcare acquired infection. That is, uh, it can be within a OR, it can be outside the OR. So, and there, in the developed countries, there are 2% chances of surgical complication in every 234 million. But for the developed countries, for underdeveloped countries, like countries like Pakistan, Afghanistan, and African countries, this data is very high. The chances of here in Pakistan and developed nation is more than 11%. Okay, uh, and there is also this patient safety and the infection can also uh, play a very negative role in inflation, in wastage of resources, wastage of economy. As currently, if in Pakistan we measure that our more than 36% expenditures are on healthcare medicine, healthcare equipments, and healthcare resources. So we can save 20 to 40% resources. Now, as everyone know, the surgical care is very essential component of healthcare. Surgical intervention is very necessarily required, and it is can be considered the final or the last management, the end for disease management. Like surgical intervention, uh, they are all kindly mute your. I would like to request to admin kindly mute the mics. Uh, Thank you. Thank you.
इसमें चलेंगे
Mr. Naveed, I think you're muted, Mr. Raza. So please unmute him.
We cannot hear you, the presenter. I think there is a breach.
Mr. Naveed, please unmute Mr. Raza.
I'm doing, but it's not. I think, Mr. Raza, can you unmute, please?
Okay, now can you hear me?
Yes, you can hear. Yes.
Okay. Now I'm audible to all.
Yes.
Yes, now it's perfect. Please carry on.
Okay.
Yes. Like we discussed, that the surgical care is a very essential and essential part of disease management, patient management, and it is sometimes it is the last part. It is the last chance the patient goes for surgery. Most of the time, doctors try to cure the patient through medication, through other intervention, and finally they goes for surgical intervention. So now imagine if the patient is going for his last chance to get treated and get cured for his disease. And now, due to our negligence, due to miscommunication, due to other issues, the patient can get harmed. Unsafe surgical procedure can death and disability. In developed countries, the death ratio is now higher than 2%, while the major complication ratio is more than 3 to 17%, in range between 3 to 17%. And this data is far high for the developed countries. And usually, these negligence, these incidents can happen to unstandardized care, through communication gaps, and through lack of control on healthcare systems, on their processes. How can we ensure the patient safety within a war? In 2008, in Netherlands, World Healthcare Organization developed a standard checklist that's called WHO Patient Safety Checklist. It was adapted from a pilot checklist, which was filled every time when pilot fly an aeroplane. WHO took the idea that what is the key factor of success of aeroplane, then clinicians or family members and other healthcare members comes with the idea to develop a standardized checklist which should be filled before every surgery, and it should be followed within the OR, and it should be also cross-checked when we are discharging patient from OR to ward and surgical care. Now, it is a system. What is the WHO checklist approach? It is a systematic and comprehensive tool that covers three critical movements of patient. That is before the anesthesia, before surgical incision, and before the patient leaves the OR. That includes, that covers the major parts, that is team communication, patient identification, and surgical site marking, and many other essential parts like specimen labeling and other things. But as you know, the safe surgery saves lives. The patient came for their last stage of their treatment, and decide for surgery. And if we do not ensure as a treated family member their safety in our area, then it can be a major mess for all of us. Now, what is the WHO objectives for safe surgery? WHO has 10 objectives, 10 points agenda for the developing this safe surgery list. The first, to identify the correct patient. We can say that is right patient, right site. So like that, the first objective was to operate a correct patient and at correct site. The second objective was to use the method the known method, and that is already introduced to prevent harm from administration of anesthesia drugs while we are protecting the patient from pains and other side effects. It was developed to recognize the effectively prepare for the life-threatening loss of airway and respiratory function. As inshallah, when we discussing, when we see the checklist, this point will be clarified more. It is developed to recognize the effectively and to prepare for the risk of high blood loss, to estimate what is the blood loss in surgery. It is also introduced to avoid the inducing an allergic or adverse drug reaction for which the patient is known to be at the significant risk. And it is used consistently for the methods known to minimize the risk for surgical site infection. It can help to prevent retention of instrument within the operating fields, within the cavity, within the surgical wounds. It secure and accurately identify all surgical specimen. And if sometime any members forget to labeling, then this checklist will help. Am I audible? I think there is network issue.
You are still audible.
Yes, audible.
You're audible. We can hear you, sir.
Okay, thank you. So just
Yes, Raza, you can carry on.
Please go ahead.
okay. So this is the patient safety. Sorry, this is the patient safety checklist. As you see, there are 3 parts. That is sign in, time out, and sign out. Inshallah, we will further discuss these essential parts. The first part, sign in, it should be filled before the induction of anesthesia. Ideally, it should be filled within the presence of surgeon or surgical team member. Okay, this part covered the patient identity, the patient procedure, and site information. It ensured the consent of patient for surgery, the involvement of patient for their surgical intervention decision. It also helped to identify that the operative site is marked appropriately. It also it also ensure the functioning of tools which are being used for the surgery and anesthesia, like pulse oximeter and other anesthesia machines. It also review between the checklist of anesthesia and coordinator. It also review the estimated blood loss and the non-allergic reaction and other anesthesia-related safety checklists. So that is the sign-in part of this. The second essential part is timeout. Timeout, when we do timeout, the timeout should be done after induction and before the surgical incision within the presence of entire team. That can be that surgeon, anesthetist, scrap technician, circulator, and other essential core team of surgery. In this part, each and every team member introduce him, herself by name and role. They take a pause to confirm the correct operation, the correct site, the ensure the patient identification. Anesthetist and anesthesia nurse and surgeon should all individually confirm their rules, their engagement for the patient, and they review all anticipated critical events like unexpected, blood losses, unexpected stabs, operative duration, and any anesthesia-related concerns. In this site, nurse also confirm about the antibiotic dose, the prophylactic antibiotic to save also AMR. And in this step, we also ensure that all required essential imaging are displayed appropriately to plan a right intervention on right side, right decision. The third and final part of this checklist, that is sign out. In this step, this should be done immediately or during the surgery, after when we are arrived on wound closure, on when we done a wound closure. Okay, and it should be done before the discharging of patient from OR. In this step, we confirm the what is surgery surgical procedure performed on the patient, and we ensure that all surgical steps and intervention are recorded. We check the swab, ensure the final swab instrument count, needle count that should be complete. And if there is any conflict, then we should reconcile before the closing of wound and surgical cavity. In this procedure, we also notify the team to label the surgical specimen correctly. We also highlight the equipment-related surgical concerns if happened during surgery to ensure the safety of next patient. And we also verbalize our plans, concerns for the recovery, post-op care for the patient, like if the patient need to retain in recovery or need to shift in ICU, etc. Now, another key point that is very essential, then on which kind of patient this checklist should be filled. So this checklist should be filled on all major procedure in which surgical count is required, and it should be filled on all minor procedure. And the swab count should be done in every major and minor procedure. Like it can be the duration of 10 to 15 minutes, and it can be long for hours. So all type of surgical procedure, we need to perform this checklist. And please do remember, and all type of surgical procedure in which we go on the second or third layer, deeper than second or third layer, then the swab count are essential in such kind of patients. Now, it is a very easy calculation that through this checklist, how we can save much more lives. We can save 230 million peoples that are operative each year, and we can save at least 1 million of them from dying due to the complication. And at least we can save 500,000 people's lives through this surgical safety checklist. As we discussed, it standardized the steps, is focused on effective communication and it ensures that the right procedure are performed on right patient, and the right the specimens and surgical outcomes are documented correctly. If there is any question or any clarity, you can write your question or your suggestion in the chat box. So, most of the hospitals, most of the peoples are doing right thing most of the time, but it is not sufficient. We need to do all of the time, all right things for the all patients. Assume a single life. Consider every single patient as a total of your KPI. Now, this is a very essential question. Why we use this checklist? I would like to ask our participant team members to get an insight why we use this checklist. You can raise your hand that we can unmute you. Anyone can suggest why it is essential to use this checklist? Or like my connection was disturbed from here. Then it is important that why we use the WHO patient safety checklist, why we use the sign out and time out checklist, what is the advantages? So it is a customizable uh, checklist. You can change, you can adopt it as per your local setting and needs. It is supported by the evidence and literature. It is evaluated and it is measured in diverse setting around the world. So now it is workable for all of setups, that is can be developed countries, underdeveloped countries, and developing countries. It can be adopted and it can be implemented with a minimal resources required uh, for its carry outing when we perform this checklist. So it can be we can perform this checklist with minimum of 3 to 4%, that is surgeon, anesthetist, runner, and scrub technician. So this, what is the advantages? This checklist also help us to standardize the steps and standardize the care. It helped to improve the communication among various team member of healthcare team. It reduced the risk of medical errors. It also ensure that the approach shown, it is also an appropriate and a good approach towards the patient safety. And this checklist has proven impact on reduction of mortality rates. Now, what are the benefits of this checklist? As we discussed, it reduces the mortality rates. It's help in improving the communication. It's fill the gap among in the communication gap between the individuals. It also helps to standardize the processes, standardize the steps. That's for induction of anesthesia. That's for the carry outing of procedure. That's uh, can be for the notes and specimen labeling, like other than, and it helps to prevent the complication that can be pre-op complication, intra-op complication, and post-op complication that we already also knows each of everyone are from OR family, so we knew that there are a lot of complication
related to anesthesia before the surgery. During surgery, there are a lot of complication which can be happen due to surgical intervention, and the post-op there are chances of anesthesia and surgery and the team member complication related to anesthesia, surgery, and the team member communication. It can be the loss of sample. It can be the loss of patient's post-operative notes like that. So, what are the key challenges when we are going to implement this checklist? Usually, when I adopt this checklist and introduce in my settings, there I face a lot of resistance because the surgeons, the anesthetists, and our team members that can be script tech or runners don't want to change their past practice. They don't want to take extra initiative or go an extra mile than the decided one. So the first key challenge is the people resist to change. People's blame or claim that we have lack of resources. How can we adopt this checklist? And sometimes most of the surgeons claim that we have time constraint and we need to start the surgery very quickly. We don't want to waste the time. So for information of them, the time is not important than the saving life of a patient. Okay, so we are doing the surgery to save to save the patient's life, to save the surgical outcome, and to save the surgical intervention. So these benefits are the keeping the benefits of this checklist in mind. Then and we when we balancing the pros and cons of this checklist, then the benefits of this checklist are most far high than its disadvantages like the time constraint, lack of resources, and resistance to change. So if we adopt this checklist and implement in our healthcare setup, then it will definitely improve the surgical intervention and surgical results. This checklist is implemented already, and most of this environment, most of the for um, in most of developed countries, most of underdeveloped countries, as this checklist is focused to cover the communication errors. Okay, this checklist also show the reduction, show very good results, very good impacts in the reduction of surgical mortality and morbidity, like organ loss, life loss, and other resources loss. If when we decide when deciding to implement the checklist, the OR team members, team leader, management, administrator should assess the climate of their hospital. It is a customized tool that help to improve the communication between the all team members, and it is for the benefit all of us. Um, this checklist also help the decision making, the involvement of patient. Sometimes it's good and sometimes it's bad. We can involve the patient, but certainly not all of the time. Sometimes there is time when the patient is awake, then we can involve, and sometimes we can't involve the patient. So, especially during a war. Okay, now going to the conclusion. It is a very valuable tool for improving the patient safety and for ensuring the patient safety in OR. As we discussed, the patient safety is the absence of preventable harm, and the patient safety is also the results, the improved result and improved outcome. So it is a valuable tool for improving patient safety. It reduces the medical errors. It helps to standardize the care, standardize the steps, improve the communication, and prevent the complication. Despite the challenges we discussed, which are all are related to implementation, healthcare professionals should embrace the checklist approach to ensure the best possible outcome for their patient. And as this picture uh, very loudly saying that the role clarity is a major responsibility of healthcare administrator and management, that and the team members, that they define what is the role of each and every one for this surgery, for this event, for this assigned task. So if we do not assign the roles, then everyone as a humankind, as a human factor, we will also blame to others, and we say that this is your role, this is your task. So like this picture, the patient can fall from the straight ambulance, and the patient can be fall from the theater table. It and we blame that it is the responsibility of the surgeon, it's the responsibility of scrub tech or runner or recovery nurse or anesthetist. So before to blame each all of us or um, any one of us, we need to uh, clear clearly define our role for each and every task. Uh, Thank you. If anyone has any question, you can mention, you can unmute yourself, or you can type your question in the chat box. Inshallah,
Thank
we'll
you so
happy
much,
to.
Dr. Raza Khan, for this very informative and useful presentation regarding the patient safety and its scopes in OR. Especially patient safety checklist and its explanation and its correlation is very awesome. Again, very thankful. If anyone have a question, please raise hand. Uh, if you have question, please.
I would also request to team members from Pakistan chapter, that is newcomers or late joiner, then you should subscribe and you should enroll in our network to get an instant insight on patient safety, on surgical instruments, and on the advancement and research within the OR area. Um,
Hello, good afternoon.
yeah,
Can you hear me, please? I would like to use this medium to send a vote of thanks to the founder of this great organization, the Global Operating Room, Ade Bushola. Thank you very much. And I still want to extend my vote of thanks to the presenter and the participants, including myself, the audience, for coming off at this time in your busy, tight schedules. I have one question, which goes to Adebosula. In your own perspectives and your experience as a fellow of nurse who practice overseas and in Nigeria, what is the current trend in ensuring the patient safety in field operative experience, and what is the possible ways to improve patient safety? Thank you very much.
Thank you so much, Mr. Yusuf. I got your question. Yeah. First of all, let me say a million thanks to our presenter for today, the speaker in person of Dr. Raza Khan. It's been very insightful and it was a very informative session. I've gained a lot from the short presentation. In relation to your question, I would say, well, there are significant differences, but yet it's still the responsibility of operating room professionals to ensure that any standardized practice is enforced. The issue, not only in Pakistan or in other African regions or in Europe, the issue is always that most people don't pay attention. Like there's a bit of rush if you walk in a level 1 facility where there is no time, zero time to do anything. Maybe it's an accident case, it's a trauma case. The patient has to be under anesthesia in the next few minutes, or anything might happen. Sometimes the checklist is not followed to standard. Sometimes a lot of things are at stake. You get people rushing to do things. You get people getting to tick the boxes without actually asking the questions, which shouldn't be. Like Mr. Khan said, it's in terms of preventing errors in the operating room environment. Your license could be at stake if any error should occur. We could say that never events in surgery mostly happen because people don't really follow the checklist. Never event in terms of operating on the wrong side or operating on the wrong patient, or even omitting an equipment in the patient, omission of count, and a lot of other issues as well that go on. First of all, the timeout is about stopping and checking. So if the timeout says stop, sorry, I think I might have to mute some people. Let me see. I'm not sure. Okay. Like the timeout, I mean, it's a timeout. Basically, every activity needs to stop. That is one of the things one needs to emphasize. Everyone needs to stop. First case of the day in Europe, what we do is you make everyone introduce themselves, because sometimes you have medical students in the room, you have other professionals that weren't part of your team or that just came in for that day, maybe to shadow someone, maybe to watch the procedure. Someone knew that, because a lot of errors could actually occur as well when you don't know who is who, because everyone puts on the scrubs in the operating room environment. So you really want the introduction to be done. And at the same time, there is something called debrief session, which was introduced recently as well. You debrief your team even before the signing. So when you debrief your team, you get to plan ahead, you get to prepare in case there could be any change, and then you proceed to do the signing. Basically, about the question I was asking about best practices. So the thing is, everyone really needs to stop, everyone needs to be introduced, everyone needs to pay attention while trying to implement the checklist. There was something introduced in the US recently, which one of the leaders actually shared. That is the checklist board. So the checklist board it has a click sound. So when it clicks, when you mention, you're introducing the patient on the table, basically, you're mentioning the name to identify as the date of birth and the hospital number. So when the person standing by the checklist board mentions that, so the person clicks that name on the checklist board, and it makes an audible sound, and no one gets to proceed to the next stage unless that is done. That stage is completed. So basically, someone needs to emphasize that all the professionals need to be involved. There should be a debrief session even after the procedure is done to ensure that any lapses are identified and practices are put in place just to ensure that there are no litigations or other errors. Thank you so much.
Hello, everyone.
Yeah.
Yes, Miss Eddie, I want to add something. You are right. One of the most and one of the critical part of the surgical safety checklist is a timeout protocol.
Yeah.
And when we do timeout protocol, everyone should be silent and like introduce on first case they introduce themselves, and after each cases, and after they should perform timeout protocol. And there's a symbol of timeout protocol, like I don't see in Mr. Raza presentation, but very well done, Mr. Raza. Thank you so much for educating us. Thank you so much, sir.
Thank you all. would like also here is a few question in chat box. The one is related to OR cleaning time. So I would like request to international fellows who are here can mention, Madam Eddy, what is the standardized cleaning time between the procedures as in Pakistan and in international JCI standard, we assume this time between 10 to 15 minutes between two clean surgeries when we shift from one surgery to another surgery. One of, am I correct, Madam Addy?
Yes.
Same in Ireland?
Yeah, you're correct. Actually.
Okay. So one question someone asked about the infected procedure. So right now, inshallah, we will share this information as about the infected procedure. There is a lot of detail. So inshallah, we will share relevant material on the group on that. So I would like to request Madam Adi and Mr. Naveed giving the closing remarks to conclude the session. Thank you.
Thank you, everyone. It's been an insightful session. It's been informative. It's been educative. We've learned a lot, basically. I believe, like someone mentioned, the time is too short, which is true. And there's a lot more to say. I could see there are many questions coming up. I think on the Pakistan chapter group, everyone can get to throw up their questions, and the question and answer session can continue at that stage so that everyone can contribute as well. A million thanks to our chairperson, Dr. Raza Khan, and all the team in Pakistan, the leadership team, Mr. Abubakar Khan, the vice chairperson, Mr. Naveed, our secretary that organized this session, and all the leaders at Dahin, Mr. Usman, and lots more. Thank you so much, everyone. And to all the members in Pakistan chapter, thank you for hosting us. And to everyone that joined from other chapters in TORG, I could see Mr. Daryl Tan is from Saudi Arabia connected. I could see Dr. Jack from Rwanda. I could see lots, Mr. Kanenga Siazilo from Senegal is connected as well. I could see Mr. Jean-Paul Niigena, that's Rwanda. I could see lots and lots more from TORG chapters connected as well. Thank you so much, everyone. The session is recorded, so we will post that on the group as soon as that is ready. Mr. Khan, do you mind sharing the documentation on the group as well so that everyone can follow up with that? And the questions can continue on the chapters page. A million thanks to everyone. It's been a wonderful session. I believe we've learned a lot and we can build on what we've learned today to improve the practices in our environment, in our operating room environment. Timeout, like Mr. Bilal mentioned, Mr. Muhammad Bilal mentioned the timeout signals. I think it's about one hand and another hand on the top of each other. One is placed vertical and something like this. That is the timeout sign. If you see that in Hioharan flyers, so everyone needs to stop. Everyone needs to take a pause. Everyone needs to do the proper introduction and everyone needs to prepare. So the ownership, we should take ownership of that activity and ensure that our patients are safe. So thank you, everyone. We will announce the next webinar, and there is one on the global platform coming up tomorrow and every 2 weeks. So we will